Hi there, my name is Adam Meester, and I am the ACL Program Coordinator here at CHKD. I'd like to welcome you to your virtual ACL class. This presentation is designed to provide you with more information as you prepare for your upcoming ACL reconstruction surgery. First off, we have a short video that provides information on the ACL injury, the surgery, and recovery.
The ACL injury in a young athlete is probably the most common injury we see. We move forward with a patient who has this injury by getting them into a rehab process typically that will address their swelling and their strength deficits and sort of decrease the inflammation that's present in the knee and get the knee ready for surgery. This injury is very common in patients under 25 years of age. The particular concern that we have in dealing with children is that some of them sustain this injury and they're still growing. We have to tailor our approach based on the patient's age, their activity demands, and we really have to make it a patient-specific approach. CHKD has a sports medicine program, and really what that means is that's not just a bunch of doctors seeing patients. That is a team of athletic trainers, physical therapists, physicians, all working together, providing their input, providing their expertise to diagnosing the problem, managing it surgically, and then providing the intensive physical therapy regimen that's required to get these patients back. So it really is a team approach. To any athlete out there who suffers this injury, is unfortunate to have to go through this, come see us at CHKD. We'll help you get back in the game.
So your ACL care team is comprised of several individuals that are available to help you through your recovery and rehab process. Your surgeon and physician assistant, you will see them for periodic check-ins in the clinic, and they will help follow your progress from start to finish. Athletic trainers, you will see them in the clinic with your surgeon. We also have athletic trainers at a lot of your schools, and they can help with exercise instruction and guidance, and that can supplement your physical therapy appointments with your physical therapist, who ideally you will see 2 times a week. And you also have me, the ACL coordinator, who will serve as an educator and communication liaison between you and your family, the physician, the physical therapist, and your school athletic trainer. So here are some images of the knee and its anatomy. These images will hopefully help you better understand the role the structures play in the long-term health of your knee. So as you can see, you have the ACL on the right, which is right there in the middle of your knee, and that provides stability to your knee. It helps prevent rotational forces of your knee, and it helps prevent shearing forces of your knee going forward or backwards. So it is very important if you put high demands and are athletically involved for quick, sharp movements with your knee. Why do we manage the ACL tear surgically? Why can't we just let it heal on its own? And that's because it doesn't heal on its own. So when your knee is unstable, surgery is the only way to manage an ACL tear to restore that stability to your knee. So when your ACL tears, it's a bunch of loose fibers and it looks kind of like a raggedy mop end. And after a short time, those mop ends and those loose fibers start to curl up and retract. So there is a gap in between the pieces of your ACL. So there's nothing that can be sewn back together, and there's nothing that kind of hangs on to regenerate itself. So the ACL has to be completely reconstructed with a new graft to become your new ligament. So the function of your ACL is it provides protection to the knee of rotational and shearing forces. and it protects other structures of your knee for the duration of your life. And the big thing is it can help prevent early onset arthritis. So if you are ACL deficient and you just keep going on with an active lifestyle, you will very likely develop arthritis at a much earlier age than you would regularly. You can also have the increased risk of damaging other soft tissues, namely your meniscus or the cartilage in between the bones in your knee. And those would, adding that to an ACL reconstruction is just another injury to the knee and another thing for your body to recover from. So as you plan for surgery, you were provided a knee brace in your pre-op surgical discussion visit with your orthopedic surgeon. So bring that post-op knee brace with you to the surgery center or the hospital. Bring your crutches. If you do not have a pair, one should have been issued to you by the orthopedic clinical staff. You will wear loose-fitting clothing because you need to have something that after surgery you can put on over top of your reconstructed knee. So with all the bandages and your knee brace, you need to have some loose-fitting clothes that will fit over top of that. Wear glasses. If you wear contacts normally, wear your glasses because you cannot wear contact lenses in the operating room. And please do not wear makeup, jewelry, or body lotion. And all of this should be reviewed by the surgery center when they call you a couple days before surgery to make sure that you're prepared for everything you need to know. So on your surgery day, you'll arrive at the hospital or the surgery center, and your surgeon will meet with you before the surgery, and they will review the procedure that they're going to be performing. The anesthesia team will then come in, or come in before or after, but they will come in also before your surgery, and they will discuss their procedure. So how they will let you have some gas to go to sleep, and then after that they will numb your leg, put your IVs in, give you all your medicine and antibiotics to help prevent infection during the surgery. So once you're ready for surgery, your family will then go to the waiting room as you are taken into the operating room. And after surgery, you'll be brought to the PACU, which is the post-anesthesia care unit, for recovery. Once you start waking up, your family will be brought in to be with you from the waiting room. Caring for your incisions. As I explained to you at your previous doctor's appointment, and that's in your ACL surgery guide, you'll have a few incisions on your knee for this surgery. It's very important to take good care of these to prevent infection and help the incisions heal well and to minimize scarring. So the steri-strips that are applied, they need to stay in place as long as possible until they start to fall off on their own. For the first few days, 3 to 4 days after surgery, you can take sponge baths or you can shower, but you must put a trash bag over your leg to keep your brace clean and dry. Please do not soak in a bath, in a hot tub, or in a swimming pool for the first 2 weeks after surgery. We do not want to submerge your knee in water to prevent any chances of other risks of infection until those incisions are really fully healed up well. So these are some post-op images. These were taken directly from your ACL surgery guide, so they should look familiar. So the first image is after you are completely bandaged up, wrapped up, you have your ice pack and your ACE bandage and then your post-operative knee brace. The second image is removing the brace, the ACE wraps, the cotton, and then you have a couple gauze pads there, and then underneath those gauze pads you will see the steri-strips and the 3 incisions that will be on your knee. And the yellow tape is the zero form, which has antibiotic on it to help prevent any infection, but those will come off, and then you will just have your steri-strips underneath. And as I reviewed in the previous slide, keep the steri-strips on. If they start to peel, you can trim the edges, but as the longer they stay on, the better chance you have of smaller scars and better healing. Graft types and indications, they will be discussed with you and your family by your surgeon at your pre-op visit. So the patellar tendon graft, or we will call it a BTB, which is bone, tendon, bone. It's a very strong graft. It has a low failure rate, and it is the most common and has been around the longest of all the ACL grafts. It does have pros and cons. Like I said, it's very strong, but some of the negatives are you can deal with anterior knee pain, so pain from the graft site where the graft was taken. If you get into something where you're going to be kneeling a lot for work or school, it could cause you anterior knee pain, later on in life. The quadriceps tendon, relatively new, been around for the last 10, 15 years. It's very successful, it's very strong. You lower risk of any anterior knee pain, but one thing that some people have noticed is that it could take your quadriceps a little bit longer to come back after surgery. It could be a little bit longer to get that initial quad strength back. It doesn't delay your overall recovery, but you could notice at the beginning it could be a little bit slower with your quad activation and recovery. The hamstring tendon, it's recommended for those that do not put a lot of high demands on their knee, that are not involved in highly competitive sports. Very good graft as well. And the IT band, this is commonly used for our younger patients that have not stopped growing, that have open growth plates and are skeletally immature, to not cross over any of the growth plates to potentially create any growth arrest. Physical therapy, that will start your quadriceps activation immediately. And we do like to start PT 3 to 4 days after surgery. At your first visit, your therapist will remove your brace, remove your dressings, check your incisions, make sure everything looks good, no oozing, no signs of infection. They will measure your range of motion. They will measure your quad activation to see, how much can you contract your quad? Can you make the muscle? Can you do a straight leg raise? Your weight bearing status will be dependent on the totality of your procedure. So depending if you have an isolated ACL reconstruction or if you have a meniscus repair with your surgery, that will determine the amount of weight you can place on your leg. And your knee brace will be locked in extension when you're walking. So anytime you're up on your crutches, your knee brace will be locked at 0, so in full extension, and it can be open for more range of motion at your physician's discretion, again, depending on the surgery procedures that were done. Your knee brace will also need to be locked in full extension when you're sleeping, because we need to maintain that extension to give us the best chance and the best outcomes with your quad activation and your full range of motion. As for pain management, we had mentioned before, anesthesia will provide you with a nerve block, and that will be done prior to the surgery beginning, but once you're in the operating room. This can be effective for several hours after surgery. It can even be still in effect until the next day. So everybody responds differently. So sometimes it's a few hours after surgery the nerve block wears off, sometimes it's the next morning. A prescription for narcotic pain medicine will be provided, and that can be supplemented with your over-the-counter medication. You will be given a prescription for that as well, but your Tylenol and ibuprofen should be alternated every 3 hours. So they are dosed every 6 hours. And then if you need to take the oxycodone, you can take it at any time with either the Tylenol or the ibuprofen. We give you the narcotic as a backup if it can be managed with over-the-counter stuff, great. If not, if it's just not touching the pain, then you can take the oxycodone, and that is to be given every 6 hours. The ice machine that you're given with the pad that's wrapped on underneath your brace, that can be used continually for the initial 3 to 4 days after surgery. And then once you start physical therapy, you can ice as you need it, or at the physical therapist's discretion if they say you need to ice this many times a day, etc. But that will help with pain and with swelling control. You can begin some of these exercises that have been provided to you starting the day after surgery. You do not need to wait to see your physical therapist before you can start contracting your quad muscle, unless you're explicitly instructed by your surgeon not to do so. But that is a very rare occurrence. Your brace will be locked following surgery, so the initial exercises at home will be focused on quad contraction and not knee flexion. So your quad sets, straight leg raises, those types of things, your patella mobilization, so moving that kneecap around to what you can tolerate. But starting to flex and contract that quad the day after surgery is a great idea to help you get things started with your physical therapy. So I'm always available to help answer any questions and to provide you guys with any assistance that I can. I'm also always accessible via my cell phone, as I'm not always in my office. And as you know, I've explained that I'm in various clinics throughout the day. So please don't hesitate to contact me on my cell phone. And thank you all for attending this virtual ACL class. And I look forward to working with you and helping you get back to the activities you love. Have a great day.